Assalamualaikum warahmatullahi wabarakatuh. We are from group 1. So for this video, we want to present about non-ionic water-soluble contrast media. So I am Nadira. So what is non-ionic water-soluble contrast media? Non-ionic water-soluble is also known as lower osmolarity. These contrast media do not dissolve into charged particle when it enters a solution, more stable and commonly used, more hydrophilic compared to higher osmolarity contrast media, less to be reactive with cell. So for the next, I continue with the preparation of non-ionic water-soluble contrast media. Procedure. So for the preparation for non-ionic water-soluble contrast media, the first one is we need to check whether the patient is pregnant, and then we need to make sure that we get the information about the history of the patient allergies, and then we need to explain in detail to the patient about the procedure so that we can make sure that they understand it and they can cooperate during the procedure. Next, the patient needs to fast before the procedure. Give the patient the advice to drink plenty of water to help ensure the proper of hydration, ensure the patient's comfort, apply pressure on injection site, ensure vital function of the patient either normal or not, and last one is observe the patient for at least 20 to 30 minutes after the injection of contrast media.
I will continue for preparation. First, follow the manufacturer's instruction for reconstituting or dilating the non-ionic water-soluble contrast media. Next, inspect the solution for any abnormalities before use. Then select an appropriate intravenous access site. Next, use the septic technique to prepare the injection site. Then attach a sterile syringe pre-filled with the prescribed volume of non-ionic water-soluble contrast media to the intravenous catheter. As for type, our group have 4 types of non-ionic water-soluble contrast media, which is iozaclate, iopamidol, ioversal, and iodaxonol. For application, non-ionic water-soluble contrast media, chemicals such as I said earlier, are frequently utilized in a variety of medical imaging procedures, such as intravenous urography, angiography, and CT scan. For CT scan, iopamidol can boost the contrast between various organs tissue, enhancing the sharpness and intricacy of CT pictures. It aids in the identification and description of anomalies such as tumors, lesions, and irregularities in the blood vessels. Iozaclate also improves contrast in CT image, making anatomical features and anomalies in the body easier to see. As for iodaxonol, it acts as convolutional neuroenhancement for CT image that make disease and anomalies easier to see. And for ioversal, it can improve contrast in CT scan in a similar way, helping radiologists acquire a good image for diagnosis. Next, I will pass to
Thank you, Alia. So I'm going to continue to explain about the application in intravenous urography, which is IVU. For iopamidol, this medication helps to diagnose diseases such as kidney stones, tumors, and obstructions of the urinary tract by enabling visualization of the kidney, ureters, and of bladder. And next one is iozaclate, which is also used in IVU to improve contrast for urinary system imaging, and this medication helps characterize and identify anomalies of the urinary tract. And after that is iodizanol. Aids in the diagnosis of and treatment of urological disorder by providing a clear view of the urinary tract in IVU. And last one is ioversal, used in IVU procedure to improve urinary system contrast, which aids in the identification of anomalies in the urinary tract. Okay, next I'm going to explain more about application of contrast media in angiography. The first one is iopamidol. used in angiography to see blood vessels, and this medication helps diagnose and arrange treatment for disorders such as vascular malformation, aneurysm, and also arterial stenosis. Next one is iosaglate, which is also used in angiography operation to see the blood arteries in different body parts with great resolution. After that, we also have iodizanol, which is also used in angiography for vascular imaging. This drug makes blood vessels easy to see and help diagnose vascular disorder. And the last one, we have ioversol, that are also used in angiography to improve blood vessel contrast, enabling precise imaging and also evaluation of vascular anomalies. So I'm going to pass to Nat to give conclusion.
So in conclusion, non-ionic contrast media offer several advantages over their ionic counterparts, including lower risk of adverse reaction and better compatibility with modern medical imaging technologies. Their reduced osmolarity and decreased potential for allergic reaction make them safer option for patients. These properties, combined with their efficacy in enhancing diagnostic imaging, make non-ionic contrast media the preferred choice in contemporary medical practice.